Well, hello everyone. This is Dr. Amig, your friendly rheumatologist, for another Unabridged MD episode. And today I am so excited to have with me Dr. Toomer. She's a phenomenon. If you have not already come across her profile on TikTok, you absolutely should follow her there. She has so much knowledge when it comes to obesity medicine, and we will go right in very soon. I just have a few announcements, actually just one very quick announcement. Mark your calendar for the first day of the fall, which is a Saturday, September 20th or 21st. It's Saturday. For a stay retreat, I'm creating with my very good friend, Ceres. She's an acupuncturist as well as a Tai Chi master. And we're creating a stay retreat. So instead of having to go anywhere, we're going to stay in Denver. And hopefully the weather is wonderful and we do this retreat outside. Otherwise, we'll do it in our very nice office on Jewel and Colorado and I-25. So register. You can just email us at info@unabridgedmd.com, or you can just look at our website. There will be a landing page, and the seats are, it's not everyone that's going to be, it's reserved. So make sure that you reserve your seat. And I look forward to seeing you there. All right. And without further ado, Dr. Toomer, thank you so much for coming on the Unabridged MD podcast. I follow you. I love your work. I'm so excited to have you. I know you're so busy. So thank you for making the time. And my first question to you is, can you tell the auditors that do not necessarily know you, they should, but what do you do and why are you doing this work?
Well, thank you for having me. So I am Dr. Catherine Toomer. I'm a family medicine and community health physician, and I founded health, wellness, and weight loss centers around a program I developed actually around my own 107-pound weight loss when I was at the end of my rope. I had just had a baby a month before. I went into congestive heart failure from that pregnancy. I was an insulin-dependent diabetic, and I started feeling very ill. And at the time, I was told that my illness was because I was obese, when in fact I was in congestive heart failure and I couldn't breathe. I was tired. And so when I went for help to get help with from someone else, I was told that I was too high risk. And so I created my own program, and now I use that program to help other people who feel like they're at the end of the rope. They feel like they're just been let down by the medical establishment. And I give people their power back and hope, and I give them options, and I give them a soft place to land, because that I became the physician I needed when I was in that position. And so this is what I do and why I do it.
Yeah, this is so powerful. And I became the physician I needed. And that makes us realize that we're so lucky to be physician, and then we want to share it with the world, right? So
Yes.
this is so wonderful. And, before I push the record button, we were talking about this relationship between inflammatory arthritis and obesity. There's tons of data now that really clearly show that the more inflammation, the more obese you are, like it's really the fat tissue causes inflammation, which can cause flare of psoriatic arthritis, of rheumatoid arthritis, or can even actually lead to rheumatoid arthritis, or psoriatic arthritis. Tell us a little bit about this population, because you see this population. Tell us more about them.
Well, it actually starts even before. Inflammation is often what leads to obesity, and then that obesity leads to further inflammation. Often, a lot of what we know about obesity is that it comes about often because of glucose dysregulation, and that glucose dysregulation in and of itself can cause problems with inflammation. And so when you combine sugar and the effects of glucose in our system, and you combine the weight bearing of weight on our lower, especially our lower extremities, that combination can cause a lot of issues, either inflammatory or just mechanical. It's just simply because of wear and tear as well. And so if you have wear and tear and you have inflammation and you have mechanical issues in terms of mobility, it starts a perfect storm within medicine, but it's also a snowball effect. One affects the other, which makes it worse, which affects the other, which makes that worse. And it just keeps going and going and going. And until you break that cycle, it's very, very difficult to overcome it.
Mm-hmm. Mm-hmm. It's very interesting. I had a patient who had very severe psoriatic arthritis, and I mean, we had tried I don't know how many biologics. And one day, when the new medications, the I think she had Trulicity or something like this,
The
and I was like,
GLP-1.
yeah, I was like, you've got to try this. You've got to try this. So she tried it. She lost 30 pounds in a couple of months. No more pain. All gone. All gone. Even the inflammation under ultrasound, it was gone.
Yes.
Tell us more about those patients, like, and maybe tell us. I think one of the things that I've come across a lot is people feel that they are a failure, or like the equivalent, right, for not being able to reach a proper weight without medication.
Yes. Well, this is the thing. It's a biopsychosocial system. And so we deal with the biology, but also the psychology and the sociology and the social interactions that occur around weight. So the first and most important thing we have to get over is our own prejudice and bias, not only towards other people who are overweight, but even ourselves when we're overweight. The other is that we need to get rid of a lot of the myths that we've been fed that it is our fault. And so, and I say this because, you can have two people eat the exact same thing. One will react differently to the other. One person may gain weight, the other person doesn't. It can't be behavioral. It has to be something else. And we know it is something else. It's genetic, it's metabolic. And so what these medications do is they go after the reasons that people respond to medication. They go after the way our body uses insulin. They go after the way our body uses cortisol. It just goes after all the reasons that our body has adapted in a way so that right now it is maladaptive. And so what the medications do in and of themselves, they decrease inflammation, not just the weight loss. And so often with people who use the medication, everyone thinks it's for weight loss, but ultimately most people, when they come to me, tell me my joints don't hurt anymore. My moods have improved. I'm sleeping better. I'm not as irritable, and I'm getting along better with my family. Then they'll tell me, oh, and by the way, I lost 5 pounds this week. The weight loss becomes secondary or third, fourth after a while, because there's so many other benefits that occur. They enjoy their jobs more. It's just so many different things.
I really like what you mentioned, which is like we are meant to believe that it's our fault. I recently became menopause surgically to prevent a recurrence of cancer, actually, really. But and I started seeing my wages go up, and I was just like, theoretically, in my left brain, like as a scientist, like in a physician, I know why. But then I was like, what am I doing wrong? And I just kept getting really upset. And you're very busy. So I found a coach, and I wasn't able to get onto your books. But yeah, so I had learned, and I was like, oh, it's not my fault. It's actually not my fault, and I'm not doing anything. Yeah, there are like little tweaks that I can do. And I really like when you say this, which is that it's not our fault. Like there are so many aspects that we have to look at. How do you address, like, I know, this is not medical advice, of course, everyone needs to know, but what would you say, like, what is your particular approach? Because for people who do not know, you're extremely successful. And we see the result. Like I follow you on TikTok and on Instagram, I believe. And I mean, we see the result of your patients. We see, or your clients, we see how they are doing so much better. What do you think is the difference in your approach versus, I mean, there are so many coaches out there for weight loss.
I would say one of the biggest that I see is my own experience. There are a lot of people who are very, very good at helping people lose weight, but who have never had to lose weight themselves. And so there's still that slight psychological, that psychosocial component of understanding. And so my language is a little different.
Mm-hmm.
The other is I approach people from a place of grace. It's very easy to go into the scientific mode and to tell people,
Yeah.
well, this is what's happening in your body and this is what's happening, whatever. My first approach is always, you know, this is I know what's happening to you as a person. And so with each person is different. And so there's no formula. It's just, you know, I always say I listen for the whisper between the words. And when people talk to me, I'm listening to what is behind them, not the words themselves. And so often I do more counseling. I do as much psychological counseling as I do biological counseling. And I help people with their families, not just with their weight loss. It's life coaching. It's really hard to explain. And in fact, I've tried to explain it. I've had many of my clients try to explain it, and they're like, I can't really explain it. It just is. It is a way of just taking people from where they are and guiding them to where they want to be. And sometimes it's guiding them to a place they didn't even expect because they didn't know they could get there.
Wow.
And
that's powerful. They didn't even know that they could get there. I think that's probably one of the most powerful message. I mean, you know, phrase that I've ever heard from a coach. So yeah, that's huge. So yeah, they know that they want something different, but they didn't even realize where they could get.
yes.
I think that's super powerful. What do you think? Because coming back to the rheumatology patients, what do you think is there? Like, how do you approach them? And of course, everyone is very individual, everyone is different, but what's the particular, if there is like something that's a little bit common, what's the thing where you say what you're thinking as a coach, as a physician, okay, those patients, they need this extra help or this extra thing. What would that be? Oops.
Well, the first thing I do is I don't assume I know what they're going through. The pain is consistent across everyone, but the reaction to that pain is different for each individual. And that's where I start. What is their reaction to what's happening? Usually when people come to me, they feel that weight loss is the solution. And I always explore why that is. And then I always explore what it is they think is going to happen from the weight loss, not just from the pain aspect, but from their life aspect. And always people put expectations onto any process. And I always want to know what those expectations are, because if they're realistic, then that's wonderful. But if they're unrealistic, I need to know so they don't get discouraged and feel, again, blame themselves when they can't reach that expectation. And so that's how I approach it. I don't even approach it from the diagnosis. I approach it from the person.
Wow, that's really powerful.
Yeah,
that's really cool. Sorry, I'm just like thinking about it and wondering all those words, because it is true that I think that the connection between the physician or really just any coach or healers, anyone that's working to help patients get back their power, right? Because it's all about empowering our patients.
Yes.
There's no, you're right. There is absolutely no one formula, but just this kindness and openness. So this podcast is about our YouTube video channel, is about giving hope driven by science. So that's the tagline, hope driven by science. Can you tell us the history where there is hope? I'm sure you have many.
Yes. Well, just the other day, actually, I have who is a former client, but she contacts me periodically just to give me updates of her life. And she came to me, and this is actually something that I often tell people. People call me a weight loss doctor. They call me obesity doctor. I'm actually neither, because I put weight loss on the end because I know that people assign a lot of their pathology, for lack of a different word, they assign it to their weight because they've been told weight is your social currency. And so when they're overweight, they think that's the problem for all the things that they aren't going on right. So I actually put weight loss on to get people to come to me because that's what they think the problem is. And then I find the real problem. either through their health and wellness measures. And so I had someone who came to me because she said, my life is in shambles. I don't know what to do. I need help. My weight is out of control. And I found the reason she was gaining weight, because there's always a reason. Weight is just a symptom. So I found the reason and we fixed it. But in the process of fixing it, we also fixed her connection to her culture, because she had stopped cooking her foods from her own culture because she thought that they were contributing to her weight gain when they weren't. She dressed differently no matter what the weather was, because she didn't feel comfortable showing certain parts of her body. But those were messages. Her daughters were seeing this. And so when she stopped doing that, that's the first thing her daughter noticed. Mommy, you're dressing differently. That was a message that she didn't even realize she was sending that message to her child. Because we corrected the underlying problem, her moods improved. So her relationship with her spouse got better. And so she keeps contacting me. There was a time when she wouldn't allow her picture to be taken. I watched her model recently for a product that she uses. And so she kept saying, yes, I came to you for weight loss. She goes, but my whole life has just been changed in ways. She goes, I can't even tell you how much I owe you. And I was like, no, you don't owe me. I showed you, but you did the work.
Yeah.
It was your work. And it wasn't even, she goes, but it didn't feel like work. And I said, because it was what you needed. And so your body everything around you adjusted to what you needed, because we hit the right spot. And so that is essentially what I look for, that sweet spot for each person where all their life just sort of clicks into place. And everyone has that spot. I found it for myself. There are ways of trying to help other people. And essentially, and it does. And we find it in medicine a lot, that right combination of medications, that right combination of behaviors, that right combination of activities that kind of feed all into this one beautiful place where everyone feels their best. And that's what I look for. And that once you have that, you won't give it up. People will hold on to that feeling forever.
That is absolutely beautiful. Well, okay. So now that we all want to work with you, where and how can we work with you? I'm like, I don't have any more weight loss issue, but I kind of want to work with you again.
Well, actually, what I say is weight health, because I actually have people who don't need to lose weight. They just want to change like their body composition. They feel like they want more muscle, or some people just want to feel healthier. They're like, I don't feel like I'm at my best. And they're like, but I don't need to lose weight. Can you help me? Yes, I can. So what I do is I come up with health plans. And the way people can do that, they can go to my website. It's drtoomer.com, drtoomer.com. And they can contact me through my website. That's the best way. Either I or my assistant will get that information and will contact you to find out what the next step should be.
All right. Wonderful. And we'll put all of this in our notes. Dr. Toomer, what a pleasure to have you.
Thank you.
I'm so glad to, get to talk with you right now, when I've just followed you, and you're such everyone go on TikTok. What's your handle again, Dr. Toomer? I don't even remember.
On TikTok, it's Dr. Toomer Talks. There was already a Dr. Toomer on TikTok, so I had to figure something else out. But that's also what I am on YouTube as well, Dr. Toomer Talks.
YouTube, yeah. And you have Facebook Lives, right? And you have Facebook Lives too, right?
I do Facebook Lives every Tuesday at 7 p.m. It goes to Facebook, LinkedIn, and to YouTube at 7 p.m. every Tuesday, where I interview other people about their wellness journeys, or what they can do to help other people, kind of in any way that we try to just get people to where they want to go.
Yeah, that's beautiful. Well, thank you again so much, Dr. Toomer. So everyone, go and watch Dr. Toomer. She's wonderful. She's very inspiring, and just if you want to get in a better health, and we all are aiming for this. And thank you so much, Dr. Toomer, again. And then Yeah, and everyone that needs a rheumatologist, I have a couple of spots available this month and then next month, but otherwise it will have to be in September. But come and check out unabridgedmd.com, and I would love to see you. This is a different type of practice, direct care, which really allows us to go very deep into things like Dr. Toomer does, which is one of the reasons I bond so much with your point of view. So thank you, everyone. See you next week. Bye-bye.